Hello, everybody. I am again going to discuss something about some of the questions that is really many person, mainly the parents of the children's, they are when worried about the coronavirus situations and symptoms or things like whether my child has coronavirus or not. That can be worrying for them. As the school already started, I thought a little bit of talk about it. NHS has quite a nice guideline, mainly NHS. So I will tell a little bit about it and what are the things you can do uh, when you think your child has that. They can get coronavirus, children can get coronavirus, but fortunately, um, actually, they seems to get it less than adult and less serious. That is a very good thing until now. Now, what are the main symptoms that you can see in coronavirus is high temperature. Number two is continuous coughing. That means coughing a lot for more than an hour or three or more coughing episode in 24 hours. A loss or a change of smell or taste. That means they cannot smell or taste anything or things well. So or they seems that taste that or smell of something that look different to them. What to do if your child has these symptoms like that? If your child has any of the main symptoms of this, then you have to get the test to check there is coronavirus or not as soon as possible. Stay at home and do not have visitors until you get the test result, and only leave home to have the test. Okay, anyone you live with or anyone with support bubble must also stay at home until you get the result. Of course, you have to get the test done as soon as possible. How it is possible to get a test? This NHS has a very clear policy to get the test done. So basically, coronavirus swab test, that is throat and nose swab, that is the easiest way to get the test done. Tests, there are multiple test site, you can go there and of course you can get a result within one day. And also you can use the home test kit, and this is of course for the people in England, Scotland, Wales and Northern Ireland. um, Now, who can get the test? Anyone with coronavirus symptom can get the test. Symptoms I already mentioned: high temperature, continuous cough, loss or change of the smell sensation or taste sensation. And you can also take the someone who live with if they have this symptom. Okay, do not get test for people who live with who do not have these symptoms. Okay, so if you are asked to get the test, you can also get a test if you live in England and have been told to have the test before you go to the hospital, for example, for surgery. Your local council asks that do the test, and you are a part of government pilot project. Important is that only get a test if you have coronavirus symptoms or have been asked to have tested. This will help to make sure who needs the test, not unnecessarily doing the test. When to get the test? If your symptoms is there, get the test as soon as possible. It should be within 5 days of symptoms. Very quite clear guidelines. Book a visit to the test site to have the test today, or order the home test kit if you cannot go to the test site. On day 1 to 4 of symptoms, you can get the test at the site or at home. If you are ordering the home test kit on day 4, do it by day 3. On day 5, you need to go to the test site. It's too late to order a test kit. If you're not able to get test in first 5 days of having symptoms, you and anyone you live with must stay at home, that self-isolate. Anyone in your support bubble must also stay at home. This is quite clear, isn't it? Now, Actually, this service is currently very busy to test now. You cannot get test now, or location of time is not convenient. Try after few hours. And there is an online site. I can write this digit 8 after my this session, so you can use that website. Or if you're not able to get it through website, then you can try call 119 if there is any problem of internet. Otherwise, website is the best way to get this done. Of course, stay at home. That child has to be stay at home. You also have to, if your child is suspected to have coronavirus. And what is this symptom? That is, of course, it is from the swab that is near nose or back of a throat with a cotton bud. It can be done that by yourself or someone can help. So, of course, parents and guardian can do if it is 11 or less than that. And if you are 12 or you can 12 or more years, you can do the swab yourself. And if other person you live have the symptom, you can order the test for 3 of them. 3 of them can be ordered. And if you are applying for a test for someone whose age is more than 13 or more, then they must consent for the test. Actually, and also, you may need to, note that sometime you may need to get the help about the symptom of your child. So now, if it is any advice you want, NHS 111 is very good service. I would recommend to use online NHS 111 coronavirus service. If it is 5 or more age. But if it is below 5, it is better to call them 111. What to do if your child is very unwell? So children and babies still get illness that can make them very unwell very quickly. It is very important that to get the medical help if you need it. Call 111 or GP surgery if he is under 3 months old and temperature is 38 or higher. And if 3 to 6 months, if temperature is 39 degrees centigrade or higher, has other symptoms of illness like rash, high fever, and persisted high temperature for more than 5 days, does not want to eat or not their usual self, you are worried, has high temperature, does not calm down with paracetamol, dehydrated, like nappies are dry, sunken eyes, no tears, they're not crying. Even if they're crying, there's not tear is coming. Now, if you think it is more serious than that, then you have to call 999. Has stiff neck, is not able to move the neck, rash that if you press the rash with a glass and it is not fading, and is bothered by light and having feet like that called we seizure of feet, and unusually cold hand and feet, very pale blotchy blue-gray skin, has a weak high-pitched cry that's not like their usual cry. They are drowsy, hard to wake, and extremely agitated or confused, finds it hard to breathe, suck their stomach in under their ribs, like that, has a soft spot on the head that curves outward, is not responding like usually they do, not interested in anything. So this is very serious and you have to then call 999. So this is the nutshell. It is very good thing is that coronavirus is not seriously affecting the children, but these are the signs I told you. Just follow them. Hopefully, you will keep your child safe without any problem. Thank you for listening me. Stay safe. Keep others safe. Bye-bye.